Hello, my name is Victoria Cox and I'm a medical doctor, originally from Adelaide, but I'm currently in Darwin, working as a frontline healthcare worker in the emergency department at Royal Darwin Hospital. I've been an Australia Day ambassador now for a couple of years and most recently attended the citizenship ceremony for the city of Holdfast Bay earlier this year. A bit more about me. Well, I was actually living in the UK until the end of last year because I had the opportunity to study public health, doing a Masters in Social Policy at the University of Oxford, supported by the General Sir John Monash Foundation. Because my long-term interest is in working to reduce the burden of tropical skin diseases in disadvantaged population groups, which is important in Australia because we know that Indigenous children suffer from some of the highest rates of problematic skin conditions in the world. But it's also important on a global scale too, because we know that 16 of the 20 neglected tropical diseases, as recognised by the World Health Organization, have skin manifestations. And so my hope in the future is to work at the intersection of evidence-based medicine and public policy, working to develop a global coordinated skin strategy, working towards universal health coverage. However, currently, my focus is on playing just a very small part in the COVID-19 public health crisis, which of course has been an unprecedented challenge for Australia. I'm particularly concerned about the potential impact for Indigenous Australians, knowing that there is such a significant risk for a vulnerable population group with poor health outcomes and unique geographical considerations, which of course has been much of the focus for pandemic planning and the response to coronavirus in the Northern Territory. Safe to say, I think it's going to be a few more months before I touch home soil. And so until then, I hope you're all able to follow healthy practices and continue to stay safe during these tricky and challenging times.